Right. Ka tangi te titi, ka tangi te kāka, ka tangi hoki ahau. Ti hei mauri ora. E ako nui ako rahi tēnā koutou katoa, e tū ana au, i rero i te maru o ngā maunga, tū mai, ngā awa, e rere. Ka mihi ake ki a koutou nungi te ahotanga o tēnei wā, e te tī, e te tā, nau mai, hara mai ki a whai whakaro ngā take mate karauna me o ngā pānga katoa. Nō reira, tēnā koutou, tēnā tātou katoa. Look, welcome along everyone and good afternoon. Thanks for joining us. This webinar, of course, is a part of our 6-part series that we're delivering right across from Taipōtini West Coast across to Waido, Marlborough, to support businesses in navigating Omicron. And as we transition, rapidly transition, it seems, to living with and navigating the realities of having COVID-19 in our workplaces and in our communities as we step through this response and navigate our way through the pandemic. These sessions have been put together thanks to the support of Development West Coast, the Nelson Regional Development Agency, NRDA, the Nelson Tasman Chamber of Commerce, and the Marlborough Chamber of Commerce as well. So they are a collaborative series to support businesses right across the region, and we've had a really positive response so far, so we're grateful that you can join us. Today we have quite a special session. We've focused the last couple of weeks on compliance and government support and the financial assistance that's available, which has been hugely helpful. But today we're really lucky because we have one of our larger businesses here in the region, New Zealand King Salmon, who have very generously offered to provide insights and knowledge that they have attained through managing health and safety throughout this COVID-19 pandemic, and more specifically with the rapidly changing and fluid situation that we're facing as we step through the Omicron response. So we're very grateful to have with us today Cameron Johnston, who is the Head of Health, Safety and Wellness at New Zealand King Salmon. And Cameron today is going to step us through a presentation on key insights and things that they've learned as part of this process and staying up to date with what is a really fluid situation. And during Cameron's presentation, you'll have the opportunity to ask any questions you like directly from a business who's working on the ground and navigating this pandemic as well. So a really valuable session today. The format is much the same as last time. If you are joining us from anywhere in the region, but if you're joining us on Zoom today, then we ask you to use the Q&A box for your questions rather than the chat. So there should be a chat and a Q&A function. Chat's great for introducing yourself and making any comments or any regards to that. But if you have a specific question, then we'll be managing that through the Q&A function just so we can keep it tidy and in one place. If you are joining us via Facebook Live, then we ask you to follow the link back to the Zoom account so you can ask questions through there. Otherwise, we'll hopefully get to your questions later. We have an hour for this session. The first part is, of course, the presentation from Cameron, and then we'll do the facilitated Q&A. After that, we will get to all the questions that you may have. So please don't be shy. Send your questions in any time. And given the amount of changes that we're experiencing and the pace at which this is rolling out, please don't be afraid to ask questions that may seem obvious, because in our experience of running the previous few webinars, when people have come through with those questions, lots of other people are thinking them as well. So please do come forward, participate and engage in the session. It's really good you could join us, and we're very grateful, and I'm pleased to welcome along Cameron Johnston from New Zealand King Salmon. So thanks for joining us, Cameron, and I'll hand straight over to you so you can get into the presentation.
Yeah, thank you very much, Johnny. So as Johnny said, kia ora all, my name is Cameron. I'm the Head of Health, Safety and Wellness for New Zealand King Salmon. We touched base with the NRDA less than a week ago because we'd just been through a significant outbreak in one of our factories that we've managed to get reasonably under control. And we thought by detailing that event that we'd be able to share some learnings with business. So my hope is that you guys pick up something that you can take away and implement at your companies. So much thanks to the NRDA and the Chamber of Commerce for this opportunity to share our learnings. Can you all see my screen okay, Johnny?
Yep, it's looking good.
Beauty. So there's a few things that I wanted to touch on today that we picked up all throughout the pandemic. So talking about New Zealand King Salmon, our controls and management, what we've had in place throughout the pandemic, and remaining fluid in response being one of the key messages. The details of our Omicron outbreak and our response, so how it occurred, how we responded, and how we've managed to slow further spread. Rat testing, talking about the pros of them and how critical I see them as for business. Communication, so discussing the benefits and methods that we've had for clear and honest communication and comms with your teams. And then just a brief overview of where we are now, followed up with some of the learnings that we've taken out of it. So the pandemic's thrown us all a lot of hurdles over the last few years, and the landscape's changed again since our outbreak. So, for example, less than a week ago when we first discussed running this forum, there was a lot we could offer in terms of learnings around traceback and close contacts, but now those learnings are all but redundant. So one of the key messages is about being malleable and not trapped into a plan or structure that doesn't allow you to change your response quickly. It became clear pretty early on in the pandemic that the only certainty was uncertainty. So to help us with this, in December 2019, we established our COVID response team, and that was made up of senior managers from across the company and included representatives from all areas. That included senior leadership, food safety, procurement, IT, logistics, operations, and people and culture. The members of that group remained fairly constant while we cycled team members in and out as needed to perform critical functions. So as new guidance came out, as a team, we interpreted that guidance and our risk and updated our plans and internal communication with our team members on a regular basis. So we developed a written response plan, but that remained very broad and open so that we could adjust to those changes as they came about. So an example of this is just recently, we weren't sure of our rat kit supply. We weren't sure what kits we would have, how we would be able to use them, who we could use them on, and we knew that situation would change really quickly. Self-testing at home was our preferred option, but we didn't know if we'd be able to achieve that. So instead of planning the frequency and the location for testing, who we would test, we just mentioned that a regime was going to be in place. We were going to base it on risk, and we assigned members of our COVID response team to review all those potential options. So through all alert levels, traffic lights and phases, the changes were regular. So early on, we adopted plans that would allow us room to respond to changes quickly. And because of that, we were able to adjust and react to the emergent landscape, which over the last month has been critical. So while our total strategy was broad, we tried to keep some things as consistent as possible to avoid confusion in the team as we chopped and changed through alert levels. So from the first lockdown, we implemented masks in our factories with screens and distancing in factories and lunchrooms, separation between shifts and factories, as well as temperature checks pre-shift. As a food processing company, we already had extremely high hygiene standards with regular deep cleans and fogging of our factories and shared spaces, but we also increased that. And as vaccinations became available, we ensured our vaccination rate stayed around 90%. And those controls stayed fairly consistent. So even if alert levels were reduced, our teams kept with those controls so they weren't having to adopt new changes each week. Some things like total factory separation were not practical to maintain at all times and actually keep running a business. So we would adjust that level of separation, often ahead of guidance from the Ministry of Health, just to match what we perceived the risk in the community. So if there was an outbreak in the community, we further isolated our teams. One of the focuses that we had before the event was looking to completely remove close contacts by definition from our sites. So we've been auditing this since the new year, and we knew where our strengths were, we knew where our weaknesses were. Even though close contacts in the workplace are no longer a thing really, it's been very useful information in identifying those strengths and weaknesses and where to aim our attention and constantly improve. So early in the pandemic, as part of our planning, we'd identified the key areas of the business and developed contingency plans should that business unit be taken out of action. Murphy's Law, this outbreak occurred in such a shift. It was absolutely critical to our continued operation and potentially one of the worst shifts that we could have affected. But we'd identified that early, and we'd identified people in the business who we could cross-train to fill those positions should the worst happen. So our operations team were able to piece together a team from around the company that managed to deliver results well above expectations and keep the company running. So that's something that I strongly encourage, and I realize for smaller teams and smaller companies may not have the luxury to implement this. We were just barely able to keep operations going. So protection of your critical work areas and teams is essential, which is why I'll mention frequently throughout this that rat testing is one of the only real controls available to business, especially as we move on from phase 3 into living life with COVID. So our controls were strong. We knew from the auditing that they were pretty well followed, and we were confident in our ability to manage any emerging situation. But then COVID threw us another hurdle. So on Monday the 14th, we were notified of our outbreak by DHB in the afternoon, advising that we had 2, which soon became 3 positive cases. But we planned for that. We trialled the scenario. We were prepared. We knew what to do. We knew who to involve. We began our internal traceback, which is somewhat redundant under stage 3. And it became pretty clear that the camera footage wasn't going to be useful and traceback wouldn't be sustainable. Due to the time frame that was requested, we had 2 individuals totaling 104 hours to review over 20 different cameras. So instead, we reverted to our reporting and auditing to identify those areas and where we should put our key focus on. So now that requirement's removed for close contacts in the workplace, and the focus is less on close contacts, traceback, and source of infection, to more of a focus on keeping positive cases out of the workplace. But the information that we gathered, learning about those close contacts, has proven important in further minimising that spread. So we can now focus on those areas and close contacts and apply further controls to minimise that spread. And that evening, because we had the 2 positive results on the one shift, we organised for that affected shift to come in and complete rat testing before they started. And during that original testing on the Monday night, we received 11 out of 23 positive rat results. So our rat regime was not meant for that level of positive results. It was meant to screen, not to find that many positives, and it was no longer safe for our team members to continue with testing at that levels. So at that point, we notified our contact at the DHB and shut down that shift and entered all 66 of those team members on the shift as close contacts that needed to be stood down. By that Friday, we'd confirmed 51 positive results in 4 days. And it was still clear that the impact of our rat regime was slowing the spread. It was evident in the positive dropping away quite quickly. Rat testing. I can't say enough about rat testing as a tool. We were prepared for rollout here because we'd originally planned to roll it out 2 weeks earlier until 2,000 of our kits were taken at the border. We'd secured more stock and we'd actually been planning to roll out that training and distribution the next day. So we were ready to roll out, just not at the scale that we were forced to. So we set up a site we'd recently purchased but not yet occupied as a rat testing and training lab. And that gave us plenty of room to test and train up to 10 people at a time and keep them safely distanced while they awaited results. That site was also used to run a drive-through PCR testing station with the Ministry of Health the next day for that affected shift. And that was extremely fortunate. It really helped us conduct the training during that breakout in a safe and controlled manner. And it's something we would have liked to have done earlier, but didn't have that luxury. And not many businesses will. So my advice would be to train your teams, supply them with kits, and start testing from now. Even if you don't have the means to test all your team members, I would at least focus on those critical areas of operation. We planned that rollout slowly across 2 weeks, and mainly because we wanted to ensure people had the kits, they were comfortable using them, and they were able to do them correctly, testing from home before they came to work. But instead, over that next 24-hour period, we trained and tested 180 people and provided them with kits to take home so they could self-test at home before work. And that's been our regime ever since. So now we've done the same for our entire Nelson processing operation, our hatcheries and our sea farms, and all of our 500 plus team members now have access to kits for self-testing before work every day. Since that self-testing has been initiated, we've conducted over 3,000 rapid antigen tests and returned 22 positives. And initially we were advised to only test close contacts. Instead, we've chosen to test all of our team. And without doing that, all of those positive rats could have led to further outbreaks at the same scale of the first. So even though it may be suggested otherwise, my advice would be to train now, begin testing everyone every day to secure your operations. As it stands, we're still receiving positive results, but they're few and far between. They're tested from home and they're not bringing further risk of spread to work. But by implementing that testing regime quickly, we managed to ring fence that outbreak to the one team. So although we picked up, some others picked it up as close contacts outside of work or in the household, we caught those people early before they went into the other departments, and we've not seen a significant spread at our other sites and shifts. So our situation confirmed to me that rat kits are by far the best tool companies have, and that's not necessarily to keep COVID out altogether, but to identify it early and minimize disruptions from mass isolation of team members as we had to do. Applications. So I imagine it's the same with most medium to large companies. The consistent cascade of information can prove quite difficult. And with confirmed cases and the potential for gossip and misinformation to spread like wildfire, frank and honest communication with the wider team is critical. Communication's always been difficult during the pandemic due to numerous changes and tweaks, alert levels, colours, phases, and all these changes have only accelerated in the last month. So this has led to a statement being true one day and then false the next. It's also meant that as a critical service, we were giving our team members information that was conflicting with information they received from the Ministry of Health. So while we told them that they're critical, they can come to work with a negative rat test, the ministry had no way of identifying those individuals as critical service workers, so they would also receive messages advising them to isolate. At phase 3, this confusion is going to be greatly reduced, but this is why, especially if you're a critical service provider, daily comms and education around the critical service exemption have been so important to us. Included in those comms, as soon as we had the data available, we began reporting our case numbers with the team daily. That was done through our online company-wide morning meeting, through email, through our COVID toolbox on the company intranet, and through text message. And trying to ensure where possible that the communications came from that single source of truth, so there wasn't conflicting information. But it seems that between that and the rat testing we were conducting, that our team members' minds were mostly put at ease, because although it was a significant outbreak, we were beginning to get it under control. Possibly one of the best tools that we had put forward for communications was from one of our team leaders. So she began holding daily Q&A sessions at the team level, which we eventually adopted over site. And these questions that the team leaders couldn't answer were added to our daily comms and sent to all team members. As it stands now, so all in all, we've now had 77 people test positive and required to stand down. So that was 53 in the first 4 days, with a peak of 23 in one day, and that's down now to 20 in the last 11, while also picking up some more unrelated cases in other areas of the business. So we were able to limit the spread predominantly to that one shift, apart from a few household contacts and mingling outside of work, because we went hard and early. We were able to minimize any further spread, but without that testing regime, it could have been much worse. Now, 52 of those 77 team members have been able to return to work, and although we still receive positive rats, they're now conducted at home in a safer environment, and I'm confident that the rat testing regime that we have in place will mean we don't see further mass disruptions to our operations. The learnings, Rats. So use rats as soon as you can. Get your team ready with rats and training to test from home now. Testing from home carries far less risk of spread than mass testing at work. So don't wait, get it done. And as I say, the best defense that we have to keep Omicron out and maintain operating at near full capacity, because nothing else will catch it before they spread in your workplace. Look, our procurement team's been amazing throughout the entire pandemic, and they've done it again, and they've secured significant stock and are willing to pass these on, especially to smaller teams who may be struggling to secure stock. So if you are struggling to get your hands on test kits, please feel free to contact them or Mick Brown at the email that's up on the screen, or you can contact myself, and we'll see what we can organise, because they've gotten us into a fantastic position. The team are going to be passing them on at cost, so not for profit. It's all about supporting those other local businesses. So yeah, either contact myself or Mick Brown and we'll look to help you out. There's a few phrases that have fallen away from the national dialogue because of the country's change in strategy. They aren't required anymore, but I would advise companies to revert back to flattening the curve and going hard and early when it comes to rat testing. So as I said, we're advised to only test close contacts, but we would not have been able to control it if that's all we did. There would have been further outbreaks, potentially just as bad as the first. The next is that masks, distancing and PPE work. So even with positive cases since the initial outbreak, we've had hardly any spread. So this includes the testers and trainers who ran testing and training for all of our team members. They were definitely briefly exposed to COVID positives, but none have contracted Omicron. And that's likely because we set them up with distancing, PPE, and minimize their exposure. And although that PPE and distancing does work, the bulk of our spread could be traced back to outside of the workplace. So those controls mean very little if people are mingling outside of work, but they will still help minimize that spread internally. Third, again, controls mean very little if your team members aren't reporting their symptoms. So during our initial testing, several people reported to us that they had symptoms for a few days, but they've been working the whole time. And as a side note to that, our thermometer checks had failed to pick up any issues with these team members. So if it's practical, individual wellbeing checks would be the best option, as well as strong communication around how leave will be paid and expectations around remaining home with symptoms, so that people don't feel pressure to come to work because they think they're not going to get paid. Fourth, identify those weaknesses in close contacts. Again, they're no longer required to isolate with rat tests, but eliminating these in the workplace will mean the reduce of spread and impact on operations. So the exercise still has value, especially if you can't access rat kits. Fifth, if you identify those critical functions in your business and create contingencies, that could be the difference between you running at a reduced capacity or running not at all. So contingencies are key, because with all your plans, it's not likely to go as you plan. Comms, so I'd prepare comms now. Communication with team members is critical. So the quicker you can have that ready with open, honest comms, the more people will feel comfortable and the less hearsay you're going to have to deal with. And in line with that, I would also prepare a register of team members. So we're lucky to have excellent support from the DHB, but I can't imagine they'll be able to maintain that level of support and service for much longer. So preparing a register that has names, date of birth, NHI number, department, vaccination status, positive test date, earliest return to work date, and when they actually return to work, that's really going to help you manage those people back into the workplace, which is going to be the role of business moving forward. And it's going to be really useful in collecting those leave support payments as well. Also, include your payroll now. Make a decision about how people will be paid and stick to it, because having that information available for team members is going to help them have that peace of mind and not make them worried about not coming to work if they're symptomatic. Lastly, just to drill it in, rats. If we'd had these early, the impact would have been minimal and response far less complicated. as it is, they really helped us stop that spread and flatten that curve. So just before I wrap up, a big thanks for this opportunity to the NRDA and the Chamber of Commerce for providing the platform to share this experience. I hope that you've taken some learnings out of it, and I hope I can help answer any more questions. And also a massive thanks to New Zealand King Salmon management and our team members for their response. It was a massive team effort. It's just by chance that I'm up here now speaking to it. And a big thanks to the DHB, and in particular Sonia Briggs, for their support and advice throughout. It was fantastic. We were really well supported. Apart from that, I'm happy to take any questions.
Cameron, that was excellent. Look, thank you so much. It's really succinctly put together and loads of valuable information. I can't emphasize enough how helpful it is to hear from a business who is doing so much in this space and that we can relate to locally, and who many on the call will have a lot in common with in terms of your circumstances and the way workforces operate. So it's been hugely valuable, and we're really grateful for the time and energy you've put into preparing that presentation. We do have some questions coming through. Please feel free to keep sending in your questions. We already have a number which we will start with now. So the first one is from Rachel, and it asks, what PPE did you use for the team who were trained to do the RATS tests?
The team that was doing the training for the RAT test had P2N95 masks. They also had full face screens and full bodysuits.
Great. And another one here from Rachel. What policy do you have for paying staff who are isolating because of a positive test if they don't have enough sick leave?
So we're going to pay them, I believe we're paying them up to 80%. Mm-hmm. And that's for the people that are isolating because they have COVID-19.
Mm-hmm. Yeah, that's great. It's up to 80%. I know that this has been a very common question throughout, and everyone's making their own judgments. So we've got another one here around, have you provided any strong guidance to staff on limiting out-of-work activities to minimise transmission risk?
No, look, I don't think that's our business. People, I want our teams to be mingling outside of work. It builds good culture, builds good teams. Unfortunately, I don't think we're in a position that we should be controlling what people do outside of the workplace. We can advise them to take the good practices home, but in the end, it's up to them. And chances are, I mean, I know when I hang out with my family, there's very little social distancing or masks involved.
Excellent, thank you. And this one is from Katrina, which is, how supportive have the staff been of the measures taken? Did you get any pushback with the registration or reporting?
No, very minimal, very minimal. Well, I've been astounded ever since we first started with this pandemic, how quickly the team mucked in together at all levels. And I talked about the hurdles that we threw at operations that did change quite consistently, and they just kept managing to leak them. So no, I mean, you're always going to get one or two, but nothing significant.
And a point of clarification, do you RAT test everyone in the company daily or just those in critical areas?
We RAT test everyone that's coming onto a New Zealand King Salmon site daily. Excellent.
So that's coming through. Rats. Martina said, has anybody here tried to access RATs under CCES? If yes, was it easy, difficult, and what was the process? I'm not sure if you can add to that, Cameron.
No, I'm not sure of CCES, but we were provided some additional RAT kits during the outbreak from the DHB, which was fantastic. And as I said, if there are people struggling, our procurement team has offered to pass them on at cost. So please do get in touch. Yeah, I've talked to Mick today and he's very confident with our stocks.
Okay, that's excellent. Really good to have, because I know many businesses have been struggling with access, as well as workers who are trying to access them themselves. So I've got a question here from Ben. Of all of King Salmon's cases, how many team members were seriously affected or ill from infections?
I only know of one hospitalized case, and that was, I believe it was in line with the average of 2 days hospitalization for Omicron. and that was largely precautionary because they suffered from asthma and were pregnant. I haven't heard of any other cases that have gone past that.
Great. And a further clarification there, which I think you might have covered, but is are your rat testing contractors coming on site? I think the answer to that was yes, wasn't it?
Yes.
Yeah. Why was it, Rachel was asking, why was it important to have the NHI number for all staff? When does that come into play?
That really helped us in terms of dealing with the DHB, so they could quickly identify our positive cases and whatnot. Like I said, I'm not sure the same level of support is going to be available to business, but if they have that ready, it's going to make it a lot easier to report and also get their test results. It may not be as important now as some of those other things.
And Aaron's asking, earlier you spoke of auditing. What does this look like in practice?
So essentially, we identified the criteria of a close contact. We created an audit that we asked operations to complete daily for about a month so that we could identify any areas where we found issues. There was only 4 questions and we asked that they do it at different areas of the business each day. We've since relaxed that and it's now just become part of our monthly auditing function because obviously when you have an outbreak like that, people do become awfully busy.
Yeah, absolutely. There's another question here from Matthew. We could cover it off a bit, but just to revisit. So any of the transmission linked to worksite practices, and are there any worksite changes as a result?
Look, we weren't able, by the time we were dealing with the DHB, there was very little interest in tracing where it came from. We believe we identified some contacts outside of work, and we definitely identified some in the workplace as well during the changeover of shifts because we hadn't put in place our separations of shift at that point as we only had 2 cases in the community. The other one that is definitely worth keeping an eye on was smoker shelters. So that was probably the only place that we didn't have hard controls. And in reviewing our video footage of those areas, we did see people huddled together smoking in close contact. So yeah, those sort of areas, particularly on the night shift when there's not as much supervision around, I'd highly recommend that people put some controls in place.
It's good advice. We have one here from Fiona Wilson. She said, I've heard from ex-colleagues overseas an observation that staff returning from being off with Omicron have returned slowly, e.g. more migraines than usual. Has that been your experience?
Look, I haven't talked to all of the team members that have returned, but the ones that I've talked to have sort of said it was a sore throat, runny nose for a couple of days, and that was about as far as it got. I haven't heard of any long-term COVID from any of our team as yet. My understanding is that is still less again than, say, Delta. But, I mean, the more cases we get, the more people are going to be exposed to that sort of thing as well. The chances of having long COVID or longer symptoms is going to be a very real thing.
We've got a couple more questions here, Cameron. Thanks so much for this. How did you train your trainers to do the rat testing? Did you get help from the DHB on this?
No, we had our supplier come in and train our training coordinators. So from those 2 training coordinators, we created our own SOP. We also took the instructions and simplified them so that all of our team members could easily understand them and put those with the kits. And then they trained team leaders, health and safety reps, charge hands, who then went out and trained the entire team.
Right. And did you send the rat kits home with people to use? And what did you provide in the kit for self-testing, if so?
So yeah, we provided them all with kits to take home and use. Originally, we had boxes of 20, which we were able to split down. And so each kit included everything that you need for that rapid antigen test. It had the solution, it had the test, the swabs and the test strips. Yeah, just everything that you would see in a normal rapid antigen kit, as well as guidance on what to do if you receive a positive result, and the contact that you should use, as well as the serve code that we were given by the GHB. It's just extra training and simplification around what to do and when.
And Fiona Wilson's asked, did many staff ask for kits for family members? Did that come into it?
Yep. So we've had people start to ask for kits for their family members. I'm not sure if we've confirmed that yet, but we're definitely seriously reviewing giving them the ability to do that. And that would be on a symptomatic case by case. So we issue these kits and we're able to keep pretty good track of where they are and how many we've got in use. One of the reasons that we split them down is so that we didn't have too much outstanding stock out in the public. But I definitely see benefits in providing it for those team members and their families.
We've got two sort of related questions here just while we're staying on the rats testing. Are you still doing tests on site, or does everyone test at home before they come in? And a related question from Petra is, how did you monitor their results and know that they were a fresh one, not just referencing an old one?
Yeah, good call. So they're all done at home. At the start, we definitely had a couple of people who weren't confident who we allowed to come to work and get tested in a designated area. I'm not 100% sure if we're still doing that, but I believe that those people were probably used to it by now and ready to go. And with making sure that they were done recently, we asked for photographs of the rapid antigen kits or the negative results before they came in, and we asked them to bring those kits in so they couldn't just use the same photo again and again and again. So each day we received the kits, we discarded them, and then do the same thing again tomorrow.
That's great. And we've just got the one more question here, although I probably shouldn't speak too soon. Some more may come through, but that's from Rachel. And a great question. Did you need to take disciplinary action with staff breaching the controls and protocols?
Oh, look, that's sort of outside my realm of function. I work within people and culture, but I'm not in the disciplinary side of things. So yeah, I couldn't comment. I'm not 100% sure, but I'm sure it would have been discussed.
Sure, look, that's absolutely fine. We've come to the end of the questions there, and we're well ahead of time, which is excellent. No one's going to be complaining about getting a bit more time back in their day. Oh, and just as I've said that, we've had another one come through. Would you have any issue with sharing the SOP or training material for doing those tests?
I'm more than happy to share anything that we've got, including the SOP, including the abbreviated one-pager, the spreadsheet that we've been using to record positive cases and their return dates. If anyone's interested in anything like that, more than happy to pass on templates.
Oh, look, that's excellent, and we're hugely grateful for the generosity of the information you've shared and your eagerness as a company to get out and support businesses who are getting through this right now. Of course, we had your email up, some email contacts up earlier, but if anyone's struggling to get in touch, then please just touch base with NRDA or the Chamber, who can forward you on as well, or go directly to King Salmon and we'll be able to get that support. We're also really keen to hear from people to see what topic they'd like to see us address next through the series. I know we've had some really good feedback from this one already, which we're hugely grateful for, but please do keep us informed through NRDA, the Chamber, or our partners Development West Coast and the Marlborough Chamber about the types of things that you'd like to see covered as we step through these webinars over the coming weeks, because we are going to keep rolling these out because we know things are so dynamic and so fluid that we need to keep the communication up and ensure that we're staying well informed and well connected as a business community. And it's been awesome to have New Zealand King Salmon supporting us with that today, with all this information. Look, there's some really, really good advice there and more information that's accessible for people. But I certainly heard a few key messages around being proactive, getting ahead of the guidance, which of course has been a really good tactic right throughout, being one step ahead of the public health advice that you're getting as a business is a really smart move. Of course, right now, the name of the game is securing stock. And as a business community, we're very lucky to have some local suppliers, but also the potential to access stock at cost price through New Zealand King Salmon at the moment, who have a healthy supply. So I think that's a really good opportunity for businesses to take up because as we've heard about the importance of that RATS testing and how that is going to be the name of the game moving forward here as we navigate this Omicron outbreak. But really important as well is that giving your team confidence through communication, that level of sort of transparency and constant communication about things early, such as how's pay going to work and what the procedures are, avoids any kind of uncertainty and confusion as you step through it. People getting affected by COVID in their families and in their households will have enough to deal with, and so if they know where they stand with their workplace, and that's hugely helpful information, but it means that the workplace has easily rolled out systems as well. So I think that being proactive, getting ahead of the guidance, securing your stock and giving your team confidence through communication will some really, really useful messages alongside everything else. And we've just got several comments coming through here, Cameron, just saying thanks so much for the useful information, that it was a really, really good session. So we had great participation, and we're even efficient enough to finish a bit early, which is great. So look, thanks again, Cameron. Thank you, New Zealand King Salmon, and thank you to NRDA, the Nelson Tasman Chamber of Commerce, Development West Coast, and the Marlborough Chamber of Commerce, who made this session possible. And we will be informing you via the emails that you received this webinar through of our topic for next week, but please do reach out if you've got something specific that you'd like addressed, and we will keep rolling these webinars out as we navigate this pandemic. In the meantime, please stay safe and continue to stay engaged, stay connected with us, and reach out for help if you need it. You're definitely not alone. A lot of businesses are doing it tough at the moment and navigating a lot of challenging circumstances. But just remind ourselves, kia tātou, we've got this as a region and as a business community. We will get through this. And so please do stay in touch. Stay safe, everyone. And we'll leave it there. Nō reira, tēnā koutou, tēnā koutou, tēnā tātou katoa. Thanks, Cameron. Thanks, everyone.
Thanks, Johnny.